So as you enter, it would be super helpful if you would just, again, put your name and your title, your department into the chat. We will use that information to continue to build our invite list and really keep everybody posted on what's going on. So that'd be fantastic. So Lisa says you cannot hear anything. You cannot hear us. I'm not sure if is that an RN thing or?
Is there other people experiencing audio issues? It looks like we're getting some, no, okay.
Okay, great. Hello, April, good to see you. I'm seeing lots of old and new friends. Thank you for joining us. It's a pleasure to have you. Again, we'll give everybody just a couple minutes. And if you again would list your name and your position, that'd be fantastic. Welcome, welcome, welcome. Thank you all for listing your names. Lots of good names coming in. Appreciate it.
I should have picked out some lunchtime tunes for the waiting. I always think about that.
That does pep up the environment a little bit.
I feel like you would have to choose very wisely, though, to pick a good like lunchtime vibe playlist.
Good afternoon, everybody, and welcome. We'll give just one more minute. Looks like people entering has slowed down a bit, so. If you are inclined, I would love to see some of you. It's always nice to put names with faces. I would love to do that. Thanks, Suzanne. Appreciate it. There's a couple others. Thank you. I don't get the opportunity to see many of you in person, so I appreciate you coming on screen. All right. Jordan, what do you think? Should we call it?
Yeah, I think here's Representative Duran's office coming on.
Good.
This is the one I was waiting for. And after that, I'll just monitor the waiting room and we can probably get started.
Great, sounds good. All right. Well, good afternoon, everybody. Thank you for attending. We have a good crowd today. 26 participants as I see it. So welcome. My name is Stephanie Villaforte and I serve as Colorado's Child Protection Ombudsman. We are here today to introduce you to the team of folks who will be implementing House Bill 24-1046. And we will be walking you through that bill and how it relates to Colorado's safety and risk assessment tool and how that in turn relates to all of you. So welcome. It's a pleasure to have you with me today for my team. I'll just have them wave. First is Jordan Steffen, my deputy ombudsman. We also have Brian Kelly, who is our policy director. And leading and managing this project, we have Yumiko Doherty. So we're pleased to have her serving as liaison between our agency and all of your agencies in this project. So with that, I am going to go ahead and kick off we'll go ahead and start a slide presentation, give you some background here. All right, so We are here because of a bill that was passed. I'll go through that momentarily. House Bill 24-1046, which essentially the legislature required that there be an evaluation of Colorado's family safety and risk assessment tools. So we are here today to introduce you to this effort. Next slide. And we have introduced you to our team, but these are the folks that you will be in touch with when you have questions, concerns, or information you just want to share regarding this project. This is the group that will be helping you out. Next slide. So really important, I think, just to give a little background on this project. There is so much that happens in our Colorado legislative sessions, and this project originates from the Colorado Child Welfare Interim Study Committee from 2023, if you can imagine. For those of you who are familiar, in 2023, the legislature created a special interim committee during the summer. It essentially ran for about 8 weeks, and their goal was they wanted to learn about Colorado's child protection system. They wanted to know what the challenges were and where they might help intervene to provide solutions to various problems that our state wrestles with on a whole host of issues. They met again for 5 different sessions. They were very intensive sessions. There were a variety of stakeholders who testified there, everybody from nonprofit agencies, county agencies, as well as state agencies. And ultimately, these legislators came to a variety of conclusions about how they want to solve a whole host of issues. And it resulted in 5 key bills that ultimately were passed in the 2024 legislative session. Next slide. And so we come to House Bill 24-1046, which is titled Child Welfare System Tools. This particular legislation really incorporated quite a few things. And just, briefly, the first part of this bill really talked about making sure that information regarding mandated reporting was sought by county human service intake workers and really trying to understand more about what is the role of domestic and intimate partner violence when a person, a mandated reporter or otherwise, makes a child abuse call. And so there were several pieces of legislation that went into that issue, including creating a standardized protocol in order to ascertain whether, in fact, there had been domestic violence or intimate partner violence. It also was really about getting the best evidence, if you will, at intake about whether such violence existed in the home. The bill also created some changes to the state-wide child abuse hotline, in which essentially callers now have to be alerted, if you will, that calls are recorded. The idea was that the legislature wanted reporters to understand what was happening during their call and not to be surprised. But what really brings us here today is this last bullet point, which is that they wanted to take a look at Colorado's safety and risk assessment tool. During the interim committee, they heard a lot of information about the difficulty of utilizing our current tool and the longstanding issues that workers in the field face in filling out the tool and concerns about its accuracy as well. As this project was placed in this House bill, our agency, the Office of Colorado's Child Protection Ombudsman, was required to guide, if you will, this evaluation process. Next slide. And so when I say guide, our responsibilities pursuant to the statute were to secure a vendor, to assist that vendor through the process, information gathering, introductions to various stakeholder partners, so that they could effectively evaluate the risk and safety assessment tools and ultimately provide recommendations if they believe that is necessary. And so that is the work essentially that my agency has been engaged now for quite some time. Just by way of background, we wrote and posted an RFP according to state procurement rules. And in that process, it resulted in 3 different vendor applications. We put together a review team, if you will, to score the applications. And that review team included the following stakeholders that you see here on the slide. We had member from, again, the Colorado Department of Human Services, County Human Services, Office of the Child Representative, Office of Respondent Parent Council, an individual with lived experience, and of course our agency. We went through a very precise process. Every aspect of an application was scored, and those scores ultimately were tallied. And today, you now will meet ICF, which is the contractor who is leading this evaluation process. Next slide, please. So again, our role was to begin the procurement process, to actually procure a vendor. Our role also is to assist the vendor in getting whatever information it needs to do its job most effectively, as well as to really learn and understand the state. Knowing that we have a county administered system, really our job is to make sure that we make those introductions to all of the county human service agencies, so that this team will have a full awareness of the differences, the regional differences that exist across our state in practice and even policy. And we also serve as the financial agent for this project. With our goal is that there'll be a final report submitted on March 1 of 2026. In order to carry out all the functions that you see before you, we were very fortunate to contract with Yumiko Doherty. And I'll have you wave just one more time, Yumiko. I think many of you are familiar with Yumiko on a variety of child welfare matters. She has been in our community for many, many years, and has great experience in all of the issues that we'll be navigating through this project. So we are pleased to have her help us with what has become a very large project. Next slide. So that is the Ombudsman's Office role and responsibilities for this project. I want to be clear that we really serve as more of the backbone of the project, right? Creating the framework, the logistics that allow the actual work to be conducted. And again, Yumiko will be your primary point of contact for any questions that arise through this project, as will Jordan Steffen, my deputy. But I just want you all to know that we've got a solid team here who are ready to answer your questions and are also very eager to learn and understand your experiences in the field as it relates to these tools. So with that, I am going to kick it off to our selected vendor, ICF, and I will let you all do your introductions.
Great. Thank you, Stephanie. It's great to meet everyone today and to be here with you. I'd love to introduce our ICF team. My name is Ann Graham. I serve on the team as the project manager, and I'm also a child welfare specialist, specializing in safety and risk assessment amongst other child welfare practice after a lot of years. We have Kate Stevenson, who was our lead evaluator, who also is very skilled and very well experienced in research and evaluation across child welfare also. We have Anna Gross, who is our research and review specialist, who brings her skills around research and analysis and organization to our team, which is fantastic. So thank you, Anna, as well as Maddie Langan, who is our lived experienced engagement and review specialist. Maddie brings a lot of skills around project management, as well as her lived experience in child welfare to our team and to the work that we'll be doing here in Colorado. Thanks, Anna. Would you move to the next slide? Thank you. So our role in this work is, as Stephanie had described, is to really be that third-party evaluator to conduct the audit, an audit around Colorado's family safety assessments, Colorado's family risk assessment, and be able to identify those tools and resources, ensuring that those assessments are carried out consistently, understanding what staff need to be able to complete those assessments real time while sitting with families, identifying gaps, exploring the impacts of geography when utilizing the assessment, and also examining the impacts of race and ethnicity when using the assessment and how they impact communities who we are overrepresented in the child welfare system. Next slide, please. Additionally, ICF's role is around evaluating and recommending best practices, sharing that assessment with families, with legal professionals, and with the judicial branch. Evaluating and recommending best practices for training, examining the assessment for domestic violence, as Stephanie mentioned, or intimate partner violence, and recommending best practices. Conducting that audit of the Colorado Family Safety Assessment, examining the issues set forth in the bill, examining interreliability of the Colorado Family Safety Assessment, and studying that required documentation for the planning and removal of the child from a child's primary caregiver. Our overall approach to meeting the audit is to be sure that we are involving stakeholders from Colorado, those folks who are on the ground, who are doing that work with families, and those who are supporting that work of those who are doing the work with families. And key of all of those are families as well. So those lived experts, those folks in the human service workforce, including those staff members, county staff folks, as well as county supervisors and county leadership. Those are the key partners who we think, as well as state leadership, are going to be informing the work that does happen and the work that could happen also. We're going to be conducting research on national best practices and reviewing Colorado-specific information against the national literature using uniquely developed review tools. We'll be using surveys, interviews, and case reviews to add to that information we're collecting around Colorado's current practices and roll that information and findings into a final report. We'll be scheduling presentations such as these to share that final report and the information in there. Kate, Maddie, and Anna will share additional details around those evaluation activities in just a moment. As far as our timeline, through the remainder of this summer, we'll be engaging those stakeholders in the various work groups. We have two particular work groups around lived experience and county folks also. We'll be developing protocols and collecting those Colorado-specific documents and conducting the research around the best practices. That will roll into fall, where we'll continue to engage stakeholders. We'll continue our research on best practices based on the additional information from Colorado we are finding and receiving, and we'll be completing that primary data collection and analysis. Moving into winter of 2025 and then very early 2026, that primary data collection will continue, and then we'll be rolling that into the final report and presentations. I'll now move the slide on to Maddie, who's going to talk to you more about engaging stakeholders.
Thanks, Anne. As we discussed in the previous slide, stakeholder engagement is a key part of this project that's going to be ongoing throughout the whole process. This ensures that our findings are not only technically sound, but they're also grounded in the realities of those most impacted. We'll engage stakeholders primarily with a two-pronged approach. So we'll have two ongoing work groups, the lived experience work group, and this group brings the voices of individuals with direct lived experience in the human services system, and their insights will help us infuse authenticity and relevance into our findings by those who have lived it. And we'll also have a human services work group composed of caseworkers and supervisors who understand the system from an operational perspective and who implement these tools daily. These work groups will meet monthly, providing continuous feedback and guidance on the work. And we'll also engage in some targeted interviews and discussions. We'll conduct focused conversations with county managers, directors, state leadership, and other key partners. And these engagements with stakeholders and their contributions will be essential to the work to make sure it's not only technically rigorous, but also deeply informed by those who are impacted and work within these systems. We can go to the next slide to talk more deeply about these work groups. Thank you. To ensure we've included the right voices, we used a structured selection process for the 2 work groups. So we began by sending formal invitations and an interest form to a diverse group of potential participants. You can see those groups to the right of the slide here. So for our worker work group, we sent out invites to the 64 county human services directors via the Colorado Human Services Directors Association. And for our lived experience work group, we sent them to the following organizations and then did some more targeted recruitment to areas that were lacking representation. And you'll see that on the next slide. A little more on this though. When we're reviewing the responses, we considered several key factors to ensure meaningful representation. Some of those considerations were the type of lived experience, so including current or former foster youth, parents with lived experience, kinship providers, and others. Workforce experience, we prioritized folks who are on the front lines using the assessments, so caseworkers and supervisors. Also familiarity with the tools, race and ethnicity to reflect the diversity of the community served, regional representation, ensuring voices from across the state are included, and availability to participate in meetings. Lived experts are compensated for their time and contributions, recognizing their value and expertise and time. Selected individuals for these groups were engaged by us, ICF, with next steps. The first human services work group meeting has happened, and we're super excited for the first lived experience work group to kick off next week. And we can go to the next slide for more of those demographics I was talking about. So now that we've walked through how members were selected, we wanted just to share a snapshot of who's participating in each group. For the lived experience work group, we've included individuals across 3 different regions representing 4 counties, each bringing unique perspectives based on their lived experience. This includes 3 parents with lived experience and 2 former foster youth. For the human services work group, we have frontline staff across 5 different regions representing 7 counties, and we have 5 caseworkers and 3 supervisors. Recruitment is ongoing for both groups to ensure we have the representation we need to gather meaningful feedback. And I'm going to hand it over to Anna now.
Thank you, Maddie. So now I'll transition us to talking about the portion of our project methodology where we are reviewing Colorado's documents. So this is including the safety and risk assessment tools, as well as informal and formal documents that are used by staff and intended to support the effective use of these tools. So some of these support documents we're talking about include training materials, desk guides, FAQs, and protocols. We want to put a plug in for if you are aware of any additional documents that you feel are critical to understand current Colorado practice. You can send them to Yumiko, whose contact information will be provided at the end of the presentation, and then we'll pass them along to us. So the review of these materials will be conducted using a tool or rubric the ICF team is creating based on the National Best Practice Research Review, which I will talk more about on the next slide. And this document review will help us gain an understanding of what a sufficient infrastructure to support caseworker effectiveness looks like. It will also help us to develop findings around how to implement a consistent use of tools across regions. And lastly, this document review is a key first step to informing the protocols for the case review, survey development, interview guides, and work group discussions, all of which we'll talk more about in subsequent slides. So as I mentioned, we'll be conducting a review of existing research related to best practices and the implementation and impact of national safety and risk assessment models and tools. This slide depicts the search strategy used to generate these findings with the criteria for initial screening, full text review, and data analysis outlined. Some example search terms include safety assessment model specific terms, including structured decision-making, signs of safety, action for children's safety assessment, family evaluation, and then some broader terms too, like safety assessment, safety tool, and risk assessment. Through this review, we're aiming to capture a comprehensive review of research that focuses on child welfare, safety, and risk assessments, also published after the year 2000, and then can be an academic publication, formal program report, white paper, or commentary. So kind of trying to capture all different types of formats. And then from there, once articles and publications are obtained, we will identify key findings and recurrent patterns and gaps in the research. We'll also summarize and compare the effectiveness of best practice models using themes related to reliability, validity, cultural appropriateness, and practical application. And like I mentioned on the previous slide, this information will be used to create the rubric and review tool we'll use for Colorado's document review, as well as help inform all other data collection efforts. Just want to note, because the national best practice research is applicable to all stages of our project, ongoing research will continue throughout the project as new information is identified. So now I'll pass it to Kate to talk a little more about our data collection methods.
Thanks, Anna. So as the rest of my team has described up to this point, there's a lot of foundational work that needs to be done in terms of understanding national best practice and expectations within Colorado. And then additionally, some of the methods that I want to walk through are kind of ways that we're layering in additional aspects to the review that we're completing. So one of those methods is case reviews. So we'll be looking at a sample of case files within Colorado and be examining those for case practice and observable documented practice as it relates to the expectations outlined in policy. And then also any other available objective measures, so things like timestamps and those sorts of things, we'll be able to pull from those case files as well. So with those case files, we're really looking to have as representative of a sample as possible. So we want to get a view of cases kind of from beginning to end, be looking at the use of those tools in removal or in reunification, particularly paying attention to populations that have particularly high involvement with child welfare. So examining how these case files might look by race and ethnicity, and then also geographical variations. And really, the point of these case reviews is to get a good sense of what the documented practice looks like, and then examine any sort of variances that might be seen through that documentation. Go to the next slide, Anna. So additionally, we're going to be looking at doing some interviews. You heard about the work groups that are with direct frontline staff and with lived experts, but we know that there are other key stakeholders and state leadership that we want to make sure that we have included and we have their voices as part of our review as well. So this will really give us some key perspectives on the tools, some really valuable insights for our reviews. But then also, as we're looking forward to any of the findings and potential recommendations that may be in the report, it can lend context in terms of organizational capacity and the ability to implement anything based on what we see in our audit. So our plan for the interviews is really up to 6 targeted interviews or discussions. We've identified key partners that we would plan to connect with for this method. And again, really the idea is to get their perceptions, hear their voices in terms of what kind of supports are available, any sort of barriers that have been identified, like known variability or observed variability. And then also we'll have targeted questions based off of our examination of documents as well as best practice. And the specific requirements within the House bill, so that we can make sure that we're getting perspectives on those particular items as well. And then, like I said, it'll be really helpful to get input as we're continuing our review to have that Colorado context infused and make sure that the things that we're looking at are the right things in the right context and leading to really the most helpful kinds of insights. You know, the next one. Thanks. And so we're trying to be as thorough and like at the breadth and the depth as much as possible. And survey methodology allows us an additional opportunity to really get more breadth with our review. So we're hoping to collect additional input from and get those insights and perspectives again in a more flexible kind of methodology, and get at some of the quality and frequency sort of perspectives around practice, guidance, and policy expectations with these tools. For this effort, we're really looking at up to 30 survey invitations, and this will allow for us to get additional perspective. We're envisioning frontline staff and managers and directors, but there may be other stakeholders through our review that we identify that this may be a good methodology to collect additional information from. And our plan with the survey then also is to be looking at perceptions, again, related to training and supports for the consistent use of these assessments, what kind of barriers are being observed, and then also providing some recommended suggestions. So perhaps those that are in the field also have ideas about what would be most helpful, and can layer that into our audit as well. Examining regional variability, disproportionality, or disparate outcomes, how the tools are used in assessment of domestic violence and intimate partner violence, and then how the tools are being supportive of consistent decision making, and then also again with those targeted questions in terms of alignment with best practice. So this was already discussed, but again, in layering with the all of the methods that we're applying, the work groups will serve additionally as a primary data source for us. So we will be looking in those work groups to apply some structured discussion guides to essentially use them as focus groups. And there are a number of elements with the bill that we want to make sure that we're examining with those work groups, both from the perspective of those that are regularly implementing the tool and have good insights into how that is from an implementation perspective, and those that are being impacted by the tool and how that feels as a family member that has had decisions made based on those assessments. And then in the end, we'll pull it all together. So in our review, we'll have our specific methods that we go through, and we'll summarize those. We'll have specific findings that will come from each of those methods that we apply. And I'm sorry, my dog wants to join the presentation in this exact moment. But we also want to make sure that we're examining across the various methods and pulling out some key kinds of themes and overarching findings across the various data sources. So we'll have the foundational elements from reviewing the documents and reviewing best practice, but then layering in, what do we see in terms of observable data elements in the case file reviews? What kind of perceptions and voices are we hearing as we conduct our surveys and our interviews and we do our work groups? And then how do we bring all of that together to make sure that our audit is well informed and representative of various perspectives, to give a more holistic analysis to this work. And then ultimately, we'll report on what we find. That is the whole goal here, is to develop a final report. Our goal for that is to finalize within the January-February timeframe of 2026. That report will summarize our methods. So that's inclusive of the results on best practice research, our review of the Colorado documents, our case review findings, themes from surveys and interviews, the discussions that we have as part of this audit, but then also displaying overarching themes and comparing Colorado practice with best practice. And then those results will also be summarized for each component of the legislation, and include recommendations as applicable. And then bringing it back to you all and relevance for you. Ultimately, this is due at the end of February, March 1st. So we will be aiming to have everything wrapped up by then, but there are opportunities to continue to hear voices and get that additional context. So the specific format and structure of final presentations is yet to be determined, but we could foreseeably be having preliminary discussions around findings as early as this winter or early 2026. And we'll really be looking to have discussions with CPO partners, so like judicial partners, youth, agency leaders, staff, to talk about this work and what we're seeing. I would envision these as being presentations that would summarize our methods, include high-level summaries of the findings around each of the legislative components, but then also potentially provide some space for facilitating action steps and thinking about now what in terms of what we're seeing in our review, so that it can help be as useful as possible and actionable for you all. And then in keeping of the theme of connecting, there are opportunities built into this for you all to inform and support the work. So first and foremost, reach out with any questions. We have Yumiko as the project manager and Jordan Steffen from CPO listed here as contacts. They're more than capable and happy to answer any of your questions. And then to the extent that they are technical specific things, they know how to reach us and filter that information as well. And then as Anna stated, if you have specific documents or critical sort of pieces that you want to make sure that we have included in our review, please do forward those so that those can get included and we can make sure that that is part of our review process. And then as we go through our additional data collection methods, just encouraging participation. So making sure that, you know, we get as great of response rate as possible with our surveys, that we're having good conversations and interviews and able to really get both like that breadth and depth of information from as many voices as possible. And then the final thing that I wanted to call out the office hours real quick, Anna. So then in this box here, I just want to also mention that ICF and Ignite the Change will be hosting office hours. So those dates and times are displayed here. It says invites coming soon, but I believe they've been posted to CPO's website, and you should be able to get that information there as well. So this is just another opportunity as we are going through the review process and conducting our audit, that we have touch points where you all can connect with us, hear about what's going on or ask questions, just so that we can be available and as transparent as possible as we work through this.
Great. Thank you, Kate, and thank you everybody for your presentation. We're happy to open it up for questions. The last thing I just wanted to leave with, though, is that our agency will be putting up a web page dedicated to this project. And so, yes, the office hours where you can find additional ways to participate are already listed there. The page itself will be going up in July. So that will have all of the information that you can have, whether that's meeting minutes, copies of the actual legislation. Our goal is to make sure that everybody who is impacted by this project has access to everything that is going in to this project. And by everything, of course, not case information or that sort of thing, but whenever this group meets in a formal capacity, right, is making decisions, et cetera, we want to make sure you have access to that. So Yumiko, I'll kick it over to you before we ask for questions. Do you have any other comments or thoughts?
Oh my goodness, no, I think that was a very thorough review of the methodology, the approach, and as you can see, we have a full team here ready and willing to kind of get your input and feedback, answer questions, respond to any concerns any of you have about the process. So yeah, I think we can open it up for questions or comments, Stephanie.
Great. I am standing by. Anybody? Hands?
Yeah, hi, this is Joe with Fremont County.
Hi, Joe.
Thank you for your thorough overview. I appreciate that. I was just curious that you kind of segmented out intimate and domestic violence. Why was that particular form of impact on a child segregated out?
You know, Joe, I can probably the best person to speak to that. That is just how the legislation addressed it. They put very specific definitions as to both of those terms. So that was just really a mirror of what has already been written.
Okay. All right.
By legislators, sorry.
Thank you.
Sure. Other thoughts, comments? Hi, Molly. It's good to see you. It's been a while. Joe, how you doing? Any questions? I do not see any. Do I, Joe?
Yes. Oh, sorry, I couldn't find the hand raise on this. Thanks for putting this together, Stephanie and crew. That was a very thorough outline and presentation of things. I noticed, and I think one of the presenters mentioned about state leadership participating in this effort, and I understand that there's an intention to want to get to the frontline staff and supervisors, but many of us have, had hands in developing our current risk and safety assessments. We certainly give direction and provide accountability to its use across the state. So whatever that looks like, and Yumiko, maybe we can talk more offline, or if there's a sense here about how we might be folded into providing feedback and thoughts as well as we kind of journey down this. We're all on board, happy to help with whatever we can do. So that's kind of my question, I guess. Are we helping enough? What more can we do to help out with this effort? And that doesn't have to be answered now. That's just our intention to partner as we move forward through this work.
Yumiko, did you want to jump in?
No, thanks so much for that, Joe. And I think you pointed out correctly, right? In terms of the two work groups, there was an intentional decision made by ICF to focus really on the frontline staff who are using the assessment day in and day out. But I do hope, as you could see in kind of an overview of the methodology and really a commitment to getting all of the various perspectives on the use of the tools across the state. And of course, that very much includes DCW as really kind of the oversight role, training, all of those things. And so absolutely, we hear you loud and clear. I know ICF has been in touch with April and has started their gathering of documents and training and things like that. So we'll definitely continue those discussions and find plenty of ways to fold you all in. I don't know, Kate or others, if you have anything else you want to add to that or more specifics. Okay, yep. And Joe and April, you definitely know how to find me. So if anything comes up, please do reach out. Great.
April and then Molly.
Sure. I just wanted to offer too, just piggybacking off a little bit of what Joe said. I think I did hear Kate or Anna, one of you guys say that, you are always looking for more participation from counties too. I mean, I do firmly believe that having a spread of counties, big and large and rural and metro is important to this too. And so if you guys are needing help in identifying counties or helping with outreach to counties that can participate, we can certainly help with that, because I think having that full perspective of how one county completes that assessment versus another, even just as simple as one county's availability for technology to be able to complete those tools is huge. So I just, I'm offering that too, if you guys need help in us outreaching, other counties that you may are missing pieces with areas of the state.
Great. Thank you, April. I appreciate that. And thank you, Joe, as well. Molly.
Yeah, thank you. And thanks for the presentation. Really helpful and interesting information. Look forward to the process very much. My question is around kind of specificity of the tool. There's a specific portion of the tool that I'm particularly interested in understanding in terms of efficacy, reliability, etc., and wondered if there would be a way to get to that, and if so, where the right place to kind of make that recommendation or ask those questions might be.
Yumiko, do you want to try that question?
And sorry, Molly, are you saying there's a specific aspect or component of the tool that you think there should be perhaps more emphasis on in terms of a review?
Exactly. Yeah. And happy to go into more detail offline, but there's one portion that I would love to understand in relation to other jurisdictions and in terms of reliability, and then depending on what we find out, thoughts about what we might do with it. So yes, exactly that.
Got it. Molly, I'll reach out to you right after this call. Maybe we can set up a time so I can hear more about some of your thoughts.
Thanks, Yumiko. That sounds fabulous.
Great.
Thanks, Molly. Other hands. I'm flipping through my
Sorry. Oh, sorry, Stephanie, just real quickly. I have the virtual hand up, but since you're looking, I just want to jump in for folks because I don't see any more. Wanted to make sure, again, the slide that said key partners and state leadership, wanted to make sure that you considered Mark Winokur and Colorado State University. They did an enormous amount of research and inter-rater reliability work on both of the tools. It's been a minute for sure, but that's definitely one that I would recommend you visit with. There's a number of reports that are public, and I think a few were mentioned during the interim committee as well. So just wanted to flag that.
Yeah, thanks, Joe. Yes, we're all very aware of all that work. Gosh, it was 13 years ago, I believe, is my last reading of the circumstances. So, but thank you, because obviously historically to understand where we came from to where we are, right, is going to be critical to this process. So thank you. And I know Becky Orsi now with Kemp is also heavily engaged in this process with Mark back in the day. So I just appreciate you making note of it. Other comments? All right, friends. Well, seeing none, I'll just turn it one last time. Jordan, is there anything as a reminder that we should leave people with? And then we'll go ahead and close out.
Excuse me. Nope. I did drop the calendar link into the chat for anyone who might want to participate in those office hours. And as Stephanie mentioned, we're going to be launching that page in July. We're recording this meeting as well as the next kickoff. So plenty of information for anyone who maybe wasn't able to make the meetings this week to go back and rewatch these videos.
Thanks, Jordan. All right. Well, on behalf of all the folks on our side of the screen, thank you all for being here today. Really, the level of participation is super heartening. And I know, just because I've had the honor of working with many of you over the years, that this is an issue that is close to a lot of people's hearts right now. So just thank you for being part of the process. And we will continue to make every effort to keep you all involved. And if we were to ever fail in that effort, you can anytime email or call me directly, and we will take care of things, I promise. So seeing no other hands or questions, we'll go ahead and conclude, and just wish you all a happy Wednesday and a great rest of the week. Thank you.
Thanks all.
All right, friends. How did it feel?
All right.
I think you guys did a fantastic job. Thank you. It was just so clean. It was succinct.